stay tuned for that information as well. We're also going to try to record the webinar as well. So we've hit the record button. So please keep your fingers and your toes crossed for us that the recording goes well. If it does, we hope to post that soon, but we will also let you know if something goes wrong with that recording or if it's available. So just stay tuned for additional information. So with that, I will give the floor to Dr. Kumar, our State Dental Director.
Good morning, Miranda. Thank you for joining the webinar. What I hope to do today is share with you the details of our guidelines, the rationale for recommending some of the procedures, and describe the role of both state and local oral health programs. Dental offices are facing challenges. So we released the updated guidelines. We wanted dental offices to open gradually. And this document was built on another document that was released on April 27th, resuming California's deferred and preventive healthcare. So this builds on that one. And after we released the document, as expected, we started getting a lot of inquiries about the. So it's expected because dental offices are facing unique challenges because of this COVID-19 epidemic. For example, PPEs are not available. So we recommend the N95 masks and respirators. And those have to be fit tested. So there are difficulties getting fit tested, even if somebody has the right kind of N95 mask. People are buying up these, and the local MOHCC, they are getting a lot of calls requesting N95 masks and gowns and all the supplies, and they don't have a whole lot. Dentists are burning up these N95 masks. Cost has gone up. It used to be 7 cents, I believe, for N95. Now it is $7. Hand sanitizer, which used to be $5, is $30. Gown, which used to be 50 cents, is $3. So you can see the cost has gone up, and the productivity will be a lot lower. So with dental offices will not be able to see multiple patients at once. So, and then employees are not coming back. They are worried about their safety. And so dental offices are facing extreme financial hardship. One estimate is that 50% of the offices may not be able to restart. So that is a huge concern for all of us, because we won't have the network if we don't have dental offices, especially those who are serving the most needy. And if they don't open, you can think of the consequences. So the first thing will be, more and more patients will end up in the emergency room, and that's what we want to avoid. So it's a balancing act here. So we want to encourage dental offices to open, but it has to be safe and financially viable and not overload the emergency rooms. So with that, I wanted to bring to this slide. When we started, we thought, okay, this is going to last for 4 to 6 weeks. The epidemic will eventually go away, and within 6 or 7 weeks, we'll be able to restart. So what we see is regional variation. So there is variation from one region to the other. And now we are seeing some of the local health officers are testing and opening up non-essential services. Of course, dentistry is an essential service. And we always ask them to provide emergency services. So you can go to, your website, your county website, public health website. You can get local information, and you have to make sure you know the pandemic in your county. Next slide, Miranda. So the stay-home executive order was issued on March 19th. This was directed at the public and focused on non-essential services. And we issued an advisory to dental offices to postpone non-urgent dental services because there were a lot of uncertainties about COVID. And we didn't have enough PPE, and we wanted to preserve PPEs for hospitals to take care of COVID patients as well as nursing home patients. And so those were based on CDC recommendations. So the recommendation in the past has always been about protecting against bloodborne pathogens, hepatitis B, HIV, and those kinds of things. But COVID requires transmission-based precautions. That's why we have new standards. Can you go to the next slide? Okay. So I wanted to show you this because there is a lot of confusion about who has the authority. So in general, so federal government issues recommendations, sometimes standards, sometimes regulations, and we have to follow that. States can have more stringent recommendation standards and regulations compared to federal government. In that case, state regulations have to be followed. And sometimes the local order will be more stringent than state. And then in addition to federal and state, you have to follow local recommendation standards and regulations. I say that you have to follow recommendations, and it is applicable in this particular case, although it is a recommendation. It's because the way it is structured. For example, CDC issues recommendations, and the state boards have those recommendations in the regulations, and Cal-OSHA specifically refers to the CDC recommendations. So what we have now is an interim recommendation from CDC, and so that gives us some flexibility with respect to how we interpret emergency, for example, the definition of emergency conditions. So we are using that one to redefine what can be done in a dental office during this pandemic. The next is the local health officer. So during pandemic, state health officers and local health officers have some extra power for isolating, quarantining, declaring, and all those things. So when it comes to COVID, what happened in California was Bay Area County local health officers issued guidance. So they recommended with respect to dental, some procedures. It was on their website, so they had to go back and revise after the state issued their guidance. Similarly, when we have issued guidance, local health officers have discretion. Depending on the conditions in their community, they may issue more stringent orders. But in advising local health officers, you have to be careful. You have to balance the safety as well as what will happen if you issue a very stringent order, because dental offices will start referring all cases to emergency rooms. So you have to be careful not to overload emergency rooms when you advise local health officers what should be done. And I generally prefer broad languages, not very specific and narrow. Only when dentists and hygienists want a lot of clarification, that's when I get into a little bit more specifics. So I would give a lot of flexibility. I would like to give a lot of flexibility to professionals so they can make some judgment, because in many cases it will be a case-by-case decision. So what about these professional organizations? I keep hearing that CDA made this recommendation, and I don't have to follow CDA recommendation. Well, so I had to talk to several dentists and explain to them the recommendation is a standard in Cal OSHA, and you have to follow that. And those are coming from the Department of Public Health because of the state health officer's order. So what CDA, ADA, what they are doing is they are providing you tools and resources to implement these recommendations. So, so in explaining to the dentists and hygienists, you may want to know the role of local, state, federal, as well as all these professional organizations. Next slide, please. So the interim guidance was issued by CDC on April 7th, and it was updated on April 27th. So there are some key concepts here. Because of the unique characteristics, dentals, we have to take some additional infection control considerations, not only bloodborne pathogen standard, but also transmission-based standards to protect against aerosols. So that's the reason why they asked the dentists to postpone elective procedures, surgeries, and non-urgent dental visits. And that was issued on 4/7 and again updated on 4/27. And proactively communicate to both staff and patients the need for them to stay at home if sick. And then to know steps to take if a patient with COVID symptoms enters office. So our guidance is based on CDC's interim guidance. There is one difference. So they recommend postponing elective procedures, surgeries, and non-dental visits, and then they outline how to treat non-COVID patients. So we are using the same protocol. Although CDC says emergency, they don't define what an emergency is. So in our case, in Amador County or in some of these counties where there are no cases or very few cases, the local health officers are asking the question, okay, we don't have pandemic in our county, and these guidance are issued during COVID-19 response. So it gives us the flexibility to define what is emergency. And what we did was we decided all those conditions that could lead to emergencies. Now that most of the dental offices have been closed for 2 months, and there are a lot of people calling the dental offices, okay, my temporary crown is broken, my orthodontic wires are coming off, my, I have these big cavities, you postponed it, now I'm feeling sensitivity. So we don't want all of them to be sent to emergency rooms. We want dental offices to take care, so prevent future emergencies. So that's why we expanded the definition of emergencies to include all those procedures that could lead to emergencies and those procedures that could prevent future emergencies. So that is the difference between the CDC's guidance and our, that's the only thing. Otherwise, the protocol for taking care of emergencies is the same protocol for non-urgent dental visits as well. So the rationale is if CDC says you can do all these procedures for non-COVID patients using these precautions, then that protocol should be applicable for non-urgent dental visits as well. Okay, so that's the explanation for expanding the definition of emergency visits in California in conditions where the nature of the pandemic has changed. So the next slide. So this is the general work practice and patient management approach recommended by NIOSH. And there is this hierarchy of controls. The most effective way to address this is to eliminate the hazard. That is, screen and rule out COVID-19 patients. So dental offices should see only non-COVID patients. So there are some questions about how do I do that? and we outline screening and testing. Then the next thing is substitutions. So we don't have a drug that can reduce viral load. So that we don't have an intervention for that. The next is engineering controls, that is creating barriers, that is in between patients. You create a barrier, whether it can be a temporary shower curtain, or it can be a permanent barrier, or it can be a plexiglass wall that can be erected during this time. And then using evacuation system. So some studies show that 90% of aerosols that are generated can be captured near the mouth. And there are some systems, we don't know how well it works, that can be used extra-orally to capture more aerosols. And then dental dam, these are placed before doing certain procedures. We cannot use it for all procedures, only for certain procedures. And there are, as I said, these other tools, HEPA filter and all those things that can be used to make the make the air, to clear the air, clear the virus out of the air. Okay, the next is administrative controls. So personal hygiene, hand washing, and all those things, limiting the number of people in the waiting room, keeping a 6-foot separation, and all persons wearing masks. So those are some of the administrative controls. And the next, of course, is PPE. So you can see the most effective is elimination, the least effective is PPE. Respirators, masks, face shield, eye protection, gloves, and protective clothing. So the problem with PPE is very hard to get it because of the shortage. We don't have a good answer right now. As you probably heard, our governor is trying his best to acquire as many PPEs as possible. There is intense competition among states. So it's a national problem, not only in California. So the next slide. So we showed, the details are here. I just want to tell you something very unique to dentistry. What I found out is dentists and hygienists, they want more clarity. The first sentence I get in the email is, we need more clarity. And there is only so much clarification I can give. Just to illustrate that one, the total length of the guidance document for resuming deferred and preventive dental care for hospitals, nursing homes, outpatients, clinics combined is 7 pages. Dentistry is 7 pages. So I have given as much clarity as possible in this document. The next slide. Okay, what do we say? We say previously, this is how you prioritize, because you don't want to burn up all N95 masks in your county. So this is the approach you can recommend to dentists. So previously, deferred treatment, as I said, some of these procedures were postponed. Dentures to temporary crowns to orthodontic treatment, they're all in the middle, and they were all postponed. So those patients should come first. And then, urgent procedures previously scheduled who are likely to develop dental emergencies. And then preventive services. But the reason I included preventive services, fluoride sealants and scaling, for example, if children are there in the office for 1 or 2 cavities to be taken care of, you might as well do some of these procedures at the same time instead of bringing back, because the cost of PPE now is $30, $40 additional cost. So when a patient is there, you might as well do as many procedures as possible. And these 3 procedures can be done without generating aerosols. There are some techniques. This is where we want to mobilize all the expertise we have among 100 or so people involved in local oral health programs. We have dentists, epidemiologists, dental hygienists, program specialists, administrators. We want to pull together all the resources. We want to work as one team and come up with resources about how to do toothbrush prophylaxis or how to do sealants without using air water syringe and high-speed evacuation. So there are all these techniques. So we want to put together resources and give it to dentists and hygienists about how to do this during this time of COVID. And then the non-aerosol generating dental procedures. And it's very difficult to practice dentistry without generating aerosols. So I know that. So if we are generating aerosols, how do we manage it? So how do we reduce it? How do we capture the aerosols? So we should be able to put together nice resources and share it. So I'm working closely with the California Dental Association. There is a work group. They've done tremendous amount of work. So between the oral health programs and CDA and local dental and dental hygienists association, we should put together resources for our dental offices. So the next one. Next slide, please. Okay. So the first thing I want you to do is make sure that our guidance and the local health officer order, and they're all in alignment. So if a local health guidance was issued in the past, make sure that is aligned with the state guidance. So if there are discrepancies between what's on your website, county website, versus what's in the state guidance, make sure they're all aligned. Otherwise, we get tons of calls from dentists and hygienists. They get confused. The next one is, if you want stringent guidance for your county, if LA wants more restricted guidance, okay, then they have to issue a local guidance and clarify. And so all calls will be directed to LA County local oral health program. So they should be prepared to handle all this. So they should work in concert with the Dental Society, Clinic Association, all these organizations, and communicate and provide assistance to them. And if in the past, if a local health officer has not issued guidance about dental, you can stay silent and tell everybody to follow the state guidance, or you can send out a notification reinforcing CDPH guidance. So this is the first thing I want you to do as soon as you go back to the office. Next one. Next slide, please. Okay. So the updated guidance. So what's in the updated guidance? So I want to go over some of the components. So it's 11:30. I want to quickly go through the next set of slides. So there are some general guidance. As I said, local geographic orders. So make sure if there's a need for a more stringent local geographic order, align the guidance with CDPH to the extent possible if the conditions are right. Then the supplies. There should be 2-week supplies because what I'm hearing is dental offices are burning through N95s. And so if dental offices are using N95 to do prophies, and they run out of N95, next week there are emergencies, patients of record calling the dental office for emergency appointment. If they don't have N95 to take care, that's going to be a problem. So that must be made clear to them. The priority setting in the dental office. Screening and testing. So we depend on screening. I'll show you later on what we mean. And the testing we recommend is for symptomatic patients when you don't know whether the patient has COVID or no COVID. So that's the only time. Right now, for non-symptomatic patients, it's not that easy to get the testing done, especially in a dental setting. And then post visual signs in the dental office about some etiquette. The next one. Next slide, please. Okay. So evaluate the necessity of care. So prioritizing urgent conditions, deferred care, those are a priority. And then, as I said, they have to maintain physical distance in the office. So that requires some scheduling and new protocols. And then the most important thing is they have to comply with Cal OSHA standards, requirements. So there are several of them. One is very specific, develop a respiratory protection program. And the other one, all of them should have injury and illness prevention program that has to be updated. So, and training employees. So these are requirements in Cal OSHA. We are working with Cal OSHA to see if they can organize some regional meetings and webinars, and provide guidance to dental offices about how to comply with Cal OSHA requirements. So that is still in the works. Next slide, please. Okay, so this is as I said, the best way to reduce the risk is to eliminate the risk altogether, and that is by screening. So there are two considerations. One is contact, the other one is symptoms. When we started, we were using only 3 symptoms: coughing, difficulty breathing, and shortness of breath. But now CDC has included additional symptoms. So CDC recommends any of the first 3 and then 2 of these 7. So what we did was we said that is confusing. So if any symptom is present, then don't treat. Either get the patient tested, consult with a medical provider, or postpone and see what happens to the patient. So that's what we recommend. So using this, especially in counties with low incidence of COVID, they should feel comfortable seeing patients in the office, because the likelihood of coming in contact with a COVID patient is dramatically less now when these rates are stabilized, as opposed to February, March, where the reproduction factor was like 2.5. That is, one patient was infecting 2.5 people every 5 days. And if you work through that, in 30 days, that's about 400 patients. So the whole idea of social distancing is to reduce that reproduction factor. So right now, what I'm seeing from epidemiologists is the reproduction factor is below 1 in California. So that is comforting. So that means one patient is infecting less than one patient in 5 days. So if you work through that, if the reproduction factor is, say, 0.5, that means it takes about 30 days to see the next case. So it is that's the reason why we can reopen dental offices. So the next slide, please. So provision of dental care for patients without COVID-19. So if there is a patient with COVID-19, they should not enter the dental office. They should be referred right away to the medical provider for follow-up. At the minimum, dental practitioners must follow the CDC recommendations. So the details are in the CDC guidance. There are engineering controls, work practices, infection control measures, clean and disinfecting office spaces, patient rooms, and equipment. So dental practitioners have to follow these recommendations and make improvement in all these practices. The next slide, please. Okay, so as I said, we are going through PPEs. It's very difficult to get PPE. So we want to put together how to manage PPE. There are some guidance documents through CDC. So what, I think in your area, how can you advise dental offices to recycle? So that's one way to manage this. Disinfect and reuse, whether it is face shield, N95s. So something that you have to look at your county and come up with resources for dental offices. And then I know some of you are working with your Mohawk centers for supplies. I know I got a call, an inquiry this morning, and they received a request for 195 per week, something like 50 face shields per week, 100 gowns per week. So you can easily burn through those supplies. And these are reserved for hospitals right now, but they're also giving to dental offices, but it has to be managed properly. So you have to, so we can work together, how to prioritize them. We may have to develop some kind of a form depending on how many patients. For example, if Amador, if they haven't had a case of COVID in the last 14 days, and that's what their attestation says, then when do you use N95 masks? So we recommend that, we may have to recommend that they use surgical masks with a face shield on all non-COVID patients, because the likelihood of seeing a COVID-19 patient is very low. So they can preserve N95s that way and use it for procedures that involve extensive aerosol generation. So something that we have to work through, and also create a form when they say we need 100 N95s a week. We want to know, are they using it for urgent emergency or using it for everything in their office? So, some, we have to work on that one and figure out how to manage that. Next one. Next slide, please. Okay, so there are a lot of resources. CDC, Department of Public Health, ADA, American Dental Hygienists Association, and CDA has put together. Next slide, please. Okay, so CDA has a lot of resources on their website about preparing to return to practice. There are forums, there are manuals, there are checklists. So I would advise, and these are available not only to members, but also to non-members. So anybody can download, use it for their office. The next slide, please. Okay. And the California Oral Health Technical Assistance Center has posted some resources as well. Whenever we get resources, we'll be posting on this website. And also, we are working on our website. It may take some time, but we will try to post it as soon as possible on the UCSF website. So the next slide, please. Okay. So here, I want to invite Rosanna and Joanna to join me in explaining what we mean by using Prop 56 for during this pandemic. Rosanna, are you there? Miranda, can you unmute Rosanna? And
Joanna is unmuted. Rosanna, is that you?
I'm here.
Okay.
Okay.
So,
Rosanna, you want to explain?
I can start, and Joanna can also help provide some examples.
Okay.
So, what we were thinking of that can be very helpful to your community is, one, to field calls, and also provide guidance to the local health officer on the guidance. They may need some explanation. We have seen some examples, which you'll see later on, of ways as a local oral health program you can help not only the dental professionals, but also the community understand COVID-19 and what the limitations are for the dental practice. There's also Amadors doing fit testing for their dental professionals. And we've seen also where toothbrush kits are being developed with COVID-19 information, as well as other wellness information on how to take care of yourself and what are the symptoms, as well as how to get food resources and rethink your drink activities to provide wellness during this time, as well as providing organizing trainings with local dental societies, with the dental professionals to hear their concerns. And then you could also bring some of those concerns back to our office to help problem solve with your county. We know that some of you have been deployed to other public health functions, and if there's any way that you can check or if you're not available, to look at your website. And if it doesn't have anything on COVID-related issues in oral health, to get something posted, and we can share other local oral health programs that have already posted things if it would help, as well as to provide resources on your website, or if when we develop a FAQ, if that would help post on your website as well. Joanna, did you have some other things to add?
No, I think that was really comprehensive. Thank you, Rosanna. The only other thing I can think of is the guidance that we had sent out to the local oral health programs included a link for some curricular activities if teachers would want to include that while they're remotely working with their students. And I can resend that if that's helpful.
Okay, you can go to the next slide. There are some examples of what some of the local oral health programs. Joanna, you may want to walk them through some of these things. Okay, I'll do it. So this is from Orange County. They put together nice information for the providers in the county. So this is one of the activities that all local health programs can undertake. On your website, bring together all the resources that you know of. The next one is from Amador County. So training, next slide, please. Okay, so N95 respirators require fit testing, and it's not easy. That's what we are hearing for dental offices to get fit tested. If they ask somebody to come to their office for fit testing, it costs thousands of dollars. So Amador organized a fit testing session for dentists, and it was the amount of money that they used for contracting was, not that much, very reasonable. When dentists signed up, they paid, I think, $45 per person or so to get fit tested. So this is, N95 has to be fit tested in order for it to work. So there was a interesting question from San Diego yesterday. The question was, this is the kind of question we get. I want to use that as an example. So should I use an N95 respirator which has not been fit tested, or should I use a surgical mask and a face shield? So my response was, you have to use your professional judgment, because there are no studies comparing these two, right? So we have to be, in many cases, dental practitioners have to use their judgment when it comes to these kinds of issues. So the next slide, please. Okay, so Del Norte, they put together a toothbrush kit and guidance for mouth pain and food box availability, and also tobacco use and prevention program. So quit smoking. So they put together a nice package and sent it to, I think, about 2,100 families in Del Norte. So these are the kinds of activities that you can engage. Training, organizing these fit testing sessions, putting together the resources to support. So all those things. So we want to work as a team. So we have dentists, dental hygienists, epidemiologists. So we want to create work groups. And when questions come, so we should work together and prepare the responses and disseminate that information. So I'll be calling upon you to participate in these work groups to answer these questions that we'll be getting. So I think this is my last slide. Miranda, can you go to the next slide? Okay, so in summary, stay tuned for your county-specific developments. Assure county COVID screening of all staff and patients, employ workplace practices to minimize. This is some of the messages you want to give to dental office. Prioritize non-aerosol generating procedures and take precautions when you are doing aerosol generating procedures. Follow CDC guidance, and make sure you provide assistance to dental offices for training, whether it is OSHA compliance, N95 testing, and all those things. So the next slide. This is the last slide. Yes, I'm ready for questions now.
Okay, I'm here. I apologize about that. It would not unmute. There was kind of a lag. So okay. I will not mess with that button anymore and just leave it like that. All right, so let's go for the first question. It's from Naomi, and she asks, will dental insurances, including Medi-Cal Dental, support billing issues with dentists? And she has a good question, because it's true, sometimes we have heard that for if we're going to do multiple procedures in the office at one time, they may not pay for it.
Okay. So we will discuss this with the Medi-Cal Dental program. Dentists perform multiple procedures. I don't know about this question is for an FQHC setting, where if they do multiple procedures in one visit, they get the same reimbursement, whereas in dental offices, they get fee for service, so they get more money if they do more procedures. And I'll check with the Medi-Cal Dental program. They've always encouraged quadrant dentistry at a minimum. So bringing back patients repeatedly is not a good idea, because there are always appointment cancellations and issues. So especially now with PPE, we want to do as many procedures in one visit as possible. So I'll talk to the Medi-Cal Dental program. But if it is an FQHC, if they do more procedures, they get the same PPS rate. I don't think that can be changed.
Right, but that shouldn't stop them from trying to do as many procedures as they can in light of this current situation.
Right.
They can do multiple procedures, they just typically don't, but we can encourage it for safety reasons.
Yes.
Okay, there were a couple of questions about Cal OSHA requirements, so I posted the link for that. All of the Cal OSHA and OSHA requirements are online. And there was a question about the slide presentation to be made available, and we will make this available and share with everyone. And the next question is, what is the recommendation to dentists and staff concerning fit testing for N95? Who should we recommend?
Okay, so we are working with our occupational disease branch to identify trainers. There are some websites we'll be sending out links. So if you Google N95 fit testing in my area, actually it brings up several companies. So that's one easy way to reach out. If not, we'll send out a link to this national organizations that have people all over the country trained to provide N95 fit testing. So we'll provide you that link.
Okay. The next question comes from Casey. If dental offices are having trouble affording or obtaining PPE, can LOHP funds be used to purchase PPE for them so they can open?
So the problem is, the amount of money that we have in your budget is not sufficient. You'll burn up all that in 1 week because the N95 mask is $7 and a gown is about $3 I heard. Then you're talking about head covers, shoe covers. So you're talking about, $30, $40 per person. So there are 3 people, say, in an office requiring that. So you're talking about $90, $100 per patient. So it's not sufficient to support that kind of activity.
Okay. Let's see. There was a question about Amador sharing the flyer for the N95 Fit. Oh, it was on the slide earlier. I guess we could ask Miranda to go back to that slide about the N95 Fit testing.
Yeah.
And then the next question is from Jennifer. Are we able to build a LOHP for any of this COVID-related activities?
Okay. So if it is oral health related activity, yes. We want you to, right now, nobody is in school. And in a very difficult to undertake any of the activities related to objectives 6 through 11. So your work should be, how do you support, dentists and dental hygiene workforce? That is what we want you to do in the next 2-3 months to support the dental workforce. So we will have a strong network. We want to maintain this network of dental, dentists and hygienists. That's number one. Number two, we want to create a safe environment that there is no transmission of COVID in a dental setting. So those are activities that can be accomplished through training, providing resources, guidance, and creating, even if you want to create a, say, community of practice in your county, all those activities, you can do it with the Prop 56 fund. But if you say, I want to use Prop 56 fund to do, say, contact tracing, which has nothing to do with oral health, then I'm sure California dentists will be really upset because they're the ones who supported Prop 56, and they're the ones who advocated, mobilized, and got the funding. And then when they need the assistance, you're not helping them. It's not going to go well. So that's why we want to focus on supporting the dental workforce using Prop 56 during this COVID pandemic.
Jay, I'd like to add one thing. That if there are any questions about what you are proposing to do, please contact your grant manager, your health program consultant, or you can email the dental director mailbox.
Okay, and the next question comes from Jan. She asks, please define toothbrush prophy. Explain when it is warranted, and is this a billed procedure? Okay.
So I can answer that question, but I'm not going to answer that question. The reason is this one. I want to form a work group. Okay, Katie Conklin is going to lead that work group. I'm going to request her. And she, working with dental hygienists who are with local health programs, will come up with a protocol about how to do toothbrush prophylaxis and apply sealant. So fluoride, sealant, those are the most important procedures in children. And those two things can be done without using, without generating aerosols. So I want dental hygienists on our team to put together the resources for the state.
Okay.
So I want to use the same approach. You know, when questions come up, we'll have work groups. We want to develop the resources for the dental workforce in California.
Thank you, Dr. Kumar.
Uh-huh.
Okay, the next question comes from Jennifer. She says, we have a person in our office who is able to provide fit testing. However, we are not able to obtain fit testing supplies. Do you have any suggestions for overcoming this barrier?
Well, if you, I don't know what the equipment is. If you can contact your program manager and, provide an estimate, I'm sure we'll look at very favorably.
And the next question is from Annie. Are dental labs considered essential business that are allowed to reopen?
I would say yes. I haven't checked it, but I'm going to make a call.
Yeah, that would make sense only because, patients don't very often go there, sometimes for to look at the shade, but other than that,
Right.
People aren't going there, so that should be okay.
Yes.
There was a question about, can providers bill medical dental for any PPE expenditures?
What is that? I didn't get the question.
I think they were asking if there was any way to bill for PPE, the cost of the PPEs for medical dental.
Not really. Right now, there are no such codes to bill. I know, dental
right?
organizations are working with the insurance industry, but right now it is not.
Okay. And Jennifer asked, a dentist told me he was going to wear a surgical mask with a face shield. Is that okay?
So this is what we say. I'm going to pull out my guidance document, and the dentist should know this. If N95 surgical N95 respirators are not available, an FDA-cleared surgical mask should be worn under a full face shield. Because a surgical mask is not tightly fitted to the face, it will not provide protection against inhalation of small, potentially infectious aerosols, although it will block spatter from reaching the nose and mouth of the wearer. So as long as he understands the risk, we have given that option, because N95 is not available all the time.
Mm-hmm. All right. And Tara asks, how do we support dental staff who are being told to come back to work but aren't sure the conditions are completely safe?
So it's a contract between the employer and the employee. So in this particular case, employer has to provide the necessary equipment to ensure safety. So the employee has to go to the employer and make sure has the proper equipment to return to work.
Mm-hmm. And that they're screening patients.
The Dental Hygiene Board has clearly stated that following CDPH guidance will ensure safety.
Okay, and Jennifer asked, is there a concern for the 1 out of 4 people who are asymptomatic with COVID?
Yes, that is the reason why we recommend extra precautions. N95 masks, the cleaning, PPE use, all those things are to ensure safety because there may be asymptomatic cases. So in Tuolumne, as I understand, there were like 2 cases or so in the last 14 days. And what is the likelihood of another case? So those are the decisions that at the local health department level. If a dentist, it will be made available to the public, and dentists should look at those kinds of statistics. If the number of cases is going in the opposite direction, that's when they'll have to make some adjustments.
Okay, Dr. Kumar, and Jesse's asking, how can we expedite the process of opening up border states for Medi-Cal dental? So in Sierra County, they have no Medi-Cal dental providers, even for emergencies. And most of their citizens have to drive 2 hours or farther, or they tend to go over to the closest city right across the state border.
So
and
this is I have to go back to Medi-Cal Dental and ask them about, the providers in Sierra County. Other than that, I don't know whether this situation is because of COVID, or this is, if it is because of COVID, we can look at some solutions. But if it is unrelated to COVID, so that means it's a long-term problem, and I'll go back to Medi-Cal and ask them.
Okay, and then finally, there were a couple of people that were interested in joining the work group that you've mentioned, so we could reach out to them separately. Yes. Unless you had anything to add. Okay. Yeah. And then there are a lot of other general questions that I can address on the side. So I think that are the big questions that were asked related to this presentation. Mm-hmm. Oops, sorry, there's just a couple more just popped up. Sorry, just to confirm, are you recommending to change our scope of work to work on COVID-19 and to help support the dental workforce?
So we'll basically, yes, we're asking you to do that, and those adjustments can be made, yes.
Okay, and then a few more interested in the work group, and we can follow up with Jesse on the Sierra County question. Mm-hmm. And then Katie did provide some information about the work group, so that's very good. Thank you, Katie. So that concludes all of the questions.
Interim recommendations, whether it is toothbrush prophy, hand scaling, whether it is, all the use of N95, that is the interim recommendations during this pandemic period. So this is hopefully, in another 6 months, we'll be in a different situation. Then we can go back to what we were doing before this pandemic. Okay. Joanna, any more questions?
That is all for now.
Okay.
Yep, that looks like we can wrap up.
Yeah. Thank you very much. We really appreciate participating. We have a unique challenge. I'm sure working together we'll be able to address and provide resources so we can maintain this dental workforce network And without that, we won't be able to accomplish many of our objectives. So thank you very much for participating. We look forward to forming work groups to answer some of these questions. Thanks.
Thank you all. Hey, Miranda, can you hear me?
I can, yeah.
So there is a way to capture all of these questions.
Yeah, other people are on right now, Joanna, and can still hear you. But yes,
Okay, I
I'm
just wanted to make sure we could, the ones that we didn't answer directly, that I can send any resources, or I just want to make sure I follow up on all of these.
Yeah, so I'm gonna transfer them to a Word document, and
Oh, great.
it'll turn into our working document, so we can do a summary of Q&A and send out to them.
Oh, great.
Yeah.
Okay, yeah, there was just a few that weren't, questions for him necessarily, but we could answer to the side.
Yeah. So that sounds good. Yeah, I'll just create a Word document to work off of. So.
Okay. Thank you.
Thank you.
Okay, I'll talk to you a little later.
Okay, thanks, Joanna.
Bye.
Bye.
Thank you, Miranda. Bye.
Bye.
Bye, thanks.
Thanks, Dr. Kumar.
Miranda, you were a rock star. Thank you.
Oh,
Thank
thanks.
you, Miranda.
Thank
Everything went.
you.
Thank you. I don't know how to end it.
Oh, yeah, you could just
I think it's
disconnect. Yeah.
Oh, okay.
I'm going to stay on for a minute because I got to make sure I get all these questions. So I'll be on for a minute. Here we go. Mm-mm-mm.